Hello, good evening, everyone. My name is Dr. Vicky Bakshi, and I have actually decided to start with pulmonary medicine lectures. So, this is a kind of a pilot video lecture, and uh, just wanted to see if this lecture will benefit any student or anyone who is giving either his PG entrance examination or PG students who are actually doing their first year, second year, or third year. So I'll be starting with my first lecture, that is Haemothorax part 1, which will cover the definition and the etiology of Haemothorax. So what is Haemothorax? Haemothorax is the presence of significant amount of blood in the pleural space. So this is a pleural space which is in between the visceral pleura and the parietal pleura. So the accumulation of blood in this space is known as hemothorax. So it can either be extrapleural, it can either be due to extrapleural injury, or it can be due to a intrapleural cause. So extrapleural cause is generally trauma, which leads to disruption of chest wall tissue and violation of the pleural membrane. So it leads to bleeding into the pleural cavity. Most common source of bleeding are the intercostal arteries and the internal mammary arteries. Now, intrapleural injury, there is injury to the pulmonary parenchyma, which leads to hemothorax. Now, this hemothorax, we should remember, is self-limiting. Why it is self-limiting? Because of the low pulmonary vascular pressure. As we all know that the pulmonary vessels have a lower pressure than the systemic vessels. Now, metastatic malignant disease, they also have tumor implants which are seated on the pleural surface of the thorax. They are also a cause of intrapleural injury. So etiology, the most common cause of hemothorax we should remember is trauma. So trauma can be of two types, either penetrating trauma or non-penetrating trauma, or we can also label it as blunt trauma. So it can also be due to iatrogenic cause, either most commonly due to placement of the central venous catheter, can be traumatic thoracocentesis, or can be a traumatic tube thoracostomy or ICD insertion. Non-traumatic or spontaneous causes include neoplasia, which can be primary or it can be due to metastasis. It can be blood dyscrasia, which also includes if the patient is taking anticoagulation treatment, and pulmonary embolism with infarction, bullous emphysema, then pulmonary arteriovenous fistulae. Abdominal pathology can be there, such as pancreatic pseudocyst, splenic artery aneurysm, hemoperitoneum. Even aortic aneurysm is a cause of hemothorax. Next is catamenial hemothorax. So this is pertaining the etiology and the definition of hemothorax.